Why should your zip code predict how long you live? This is not a myth. There is data that shows that your life expectancy can be determined by where you live. Certain populations bear a disproportionate burden of disease and mortality. For this very reason, health departments across the United States are moving to address the root causes of these health inequities. Monterey County is committed to ensuring good health for all.
When we did our strategic plan here in December of 2011, when it was adopted, we were very conscientious in going out into the community to hear from the communities what they thought or they perceived were the biggest deterrents to living a long, healthy lifestyle. And we heard from them very clearly the largest contributing factor to whether or not we're successful in living a high quality, long lifespan is not necessarily our access to medical care, but it's the environment that we live in, and then to a lesser degree, the genetics. We in public health have been very active in engaging in what we call public health evolution, to look further upstream into these social determinants of health.
On Wednesday, June 26, 2013, the Monterey County Health Department launched its first community dialogue on the social determinants of health. This dialogue brought together the Seaside CA4Health Leadership Team to take a vivid look at the health inequities in their community and provide guidance in root cause mapping exercises.
Health equity is defined as an environment in which all community members have equal access to achieve their full health potential. Working to achieve health equity is the mission outlined in the Monterey County Health Department's strategic plan. To do this, we must address the complex conditions in which people are born, grow, live, work, and age. We call these social determinants of health.
Health in All Policies is a collaborative approach that integrates and articulates health considerations into policymaking and programming across multiple sectors such as agriculture, education, economic development, the environment, law enforcement, housing, transportation, and others. It seeks to improve health and at the same time contribute to the well-being and the wealth of communities through structures, mechanisms, and actions in sectors other than health. In Monterey County, Health in All Policies is a vehicle to addressing the complex issues that contribute to health inequities. By raising institutional and social support for health consideration, we can, together, work to improve the health and well-being for all people living in Monterey County. This is how we can achieve health equity. Today's dialogue is meant to introduce these concepts and to begin to understand the connections between the social determinants of health and population health.
Well, I need to preface this by saying that I've been interested in the issue of policy around health for many years. And that's because when I started off my career as a social worker, working with older clients. I had a lot of disabled women, Black, who had worked as domestics for many years. And this is in the 60s, before there were any kind of workplace policies in a lot of different places. And when I met a woman with broken down knees in her early 50s because she had had to be on her hands and knees scrubbing floors for hours at a time before her employer would let her up to eat, then I realized what race and policy and social norms had to do with how someone was helping, because that's what it had impacted her health. So coming now, fast forwarding 40 odd years and being able to look at health disparities from a structural point of view and wrap all this together in terms of policy and precursors in the mapping exercise that we did to try to identify the root cause of why at early 50s someone had severe arthritis in her knees. I could have mapped that out for that client that I had. So being able to do it from both an individual level and a committee-wide level is really exciting to me.
The highlight of today for me was focusing in on the root causes of the challenges that we have with healthcare today. And I think the pictorial picture of the tree that you use, and I can take into my community and use that tree and talk to individuals about our root causes, whether it's our city council, whether it's our churches, the root causes. But I think based on interacting with the people here today and finding out what the focuses are, that I can go home now as I walk out of the door and talk about some challenges that I have in my immediate community and work with the organizations that I'm affiliated with, basically using the tree that you provided in terms of the root causes and what makes a difference in one community versus another. And we just need to meet that challenge.